All right, let's get right into it. If you're in phlebotomy, whether you're brand new or you've been doing this for years, there is one challenge that just never goes away: the difficult blood draw. So today, we're going to break down exactly what to do when you just can't find a vein. You know that moment, right? The tourniquet's on, you're looking, you're feeling around, and there's just nothing. It's a super stressful situation, not just for you, but for the patient too. But, having a clear, calm strategy can make all the difference between a successful stick and a really frustrating miss. And that's really the heart of the matter. A successful draw doesn't just happen when the needle touches the skin. Nope. It starts with everything you do beforehand. This is all about building a solid foundation of good habits that keeps your patient safe and really boosts your own confidence. So let's start right at the beginning. You could argue that proper preparation is the single most critical factor in phlebotomy. Seriously, get this part right and you've already won half the battle. Okay, so let's talk about the tourniquet, because this is huge. It seems so basic, right? But using it the wrong way is a massive reason for missed veins. If it's too loose, well, it's not doing anything. If it's too high or too low, you're not putting pressure where it needs to be. The goal, the sweet spot, is to place it about 2 to 3 inches above your target site. And it needs to be tight enough to make those veins distend, to make them pop, so they're way easier to see and, even more importantly, to feel. And here's another thing that's so simple, but wow, it gets overlooked. As soon as that tourniquet is on, just ask your patient, "Hey, can you make a fist for me?" That simple little muscle contraction is often all it takes to help those veins become more prominent. It's just a perfect example of how your communication is a core part of the actual technical process. Okay, so we've set the stage properly. Now we can get into the real hands-on stuff, the techniques for actually finding and picking the perfect vein. So when you're looking at the antecubital area, there's kind of this hierarchy of veins. Your absolute go-to, your best choice is the median cubital vein. But the most important skill here isn't what you see, it's what you feel. A good, healthy vein has this bouncy, resilient, kind of tube-like feel to it. You want to avoid anything that feels hard or like a cord. That usually means it's sclerotic or hardened, and you're not going to get a good blood return. So trust your touch. Sometimes the best veins are the ones you feel, not the ones you see. And speaking of which, this is a safety warning we absolutely have to stop and emphasize. That basilic vein, it might look big and tempting, but it is a high-risk area. It runs super close to the median nerve and the brachial artery. And as the Center for Phlebotomy Education says right here, you should never probe or fish around for this vein. A mistake here could lead to permanent nerve damage, and that is one of the most serious injuries a patient can get from phlebotomy. Okay, so you've picked out your vein. What's next? Anchoring. This is how you stop those sneaky veins from rolling. You just place your thumb an inch or two below the site, pull the skin down so it's taut, and that's it. You've stabilized the vein, holding it in place so it can't move when the needle goes in. This is an absolute game changer, especially with smaller veins or on older patients where the skin might be a bit less elastic. And now the moment of truth. The needle always goes in with the bevel, that's the little slanted opening facing up. And the angle is everything. You're aiming for something between 15 and 30 degrees. Go too steep, and you could go right through the vein. Too shallow, and you might just skim the top. A firm, confident, and steady hand is what you need. Any hesitation can cause extra pain and, increase the chance of a miss. But look, let's be realistic for a second. Even with the most perfect prep and flawless technique, misses are gonna happen. So what do you do in that moment? How you handle that miss is really what defines you as a professional. This right here is the absolute do not do list. The worst thing you can possibly do is start probing or digging around under the skin. It's incredibly painful for the patient, and it is the #1 cause of nerve damage. If the patient says they feel any sharp shooting pain or tingling like an electric shock, that is a major red flag for nerve contact. You have to stop immediately. So, what do you do instead? The correct procedure is simple, and it's always the same because it's all about safety. First, the tourniquet comes off. Always. Then you withdraw the needle, apply firm pressure with some gauze, and just reassure the patient. This isn't a failure, it's just a necessary step. Then you can calmly move on and assess the other arm or look for another site. And all of this brings us to a final but super important point: the professional mindset. Phlebotomy is just as much about resilience and patient care as it is about all the technical skills. I absolutely love this quote because it's just so true.
Missing a vein does not make you a bad phlebotomist. It happens to everyone. I don't care how many years of experience you have. Tearing yourself down about it just adds stress and anxiety, and that is not going to help you on your next draw. Just acknowledge it, learn from it, and move on with confidence.
And really, that's the key takeaway here. No two patients are ever the same. Their veins, their anxiety, the texture of their skin, it's all different. A great phlebotomist approaches every single draw as its own unique challenge, using their skills with a calm demeanor, a lot of patience, and just genuine care for the person sitting in that chair. So it kind of leaves us with this final thought to chew on. Phlebotomy is definitely a science, right? It's full of precise angles, procedures, and anatomical knowledge. But when you factor in that human element, the steady hand, the calm voice, that intuitive feel for a good vein, it really does become something of an art.
Thank you for watching. Like, share, and subscribe.